Here's the thing. We recognize it because it's been around for a long time. It's very common. So we recognize it. Doctors know of it very well. It's not that doctors don't know what PCOS is. I think it's just not being addressed appropriately. It's not being diagnosed appropriately. It's definitely being mistreated because, again, women like you and I, young women like you and I are coming in. You know, if you're thin, maybe you're treated differently, but maybe you're disregarded. And if you're overweight, it's just horrid.
Yeah.
Because you're just told, basically it's your fault. You need to eat less and move more, right? The good old calories in, calories out. And so young women are having a really hard time with this. It's not that it's not recognized, it's just mistreated. And then in our book, Dr. Funk says, you know, if PCOS was just about a few missed periods and some acne, then I guess it wouldn't be a big deal. But even that in itself is a huge deal. That's young women, a few missed periods, irregular cycles, very painful cycles, a little bit of acne, a little bit of hair growth on your face and body. That's a huge deal. As if that wasn't enough. It isn't just that. It's this reproductive disorder that is related to and associated with metabolic syndrome because of insulin and insulin resistance. So even lean women like you and I, the science is there. So I've done a review on PCOS and the contribution of hyperinsulinemia, and it's there. The science is there. The researchers know, maybe doctors, not all doctors know, but the researchers know that insulin resistance is behind this, because even lean women with PCOS have a higher degree of insulin resistance, meaning that when you eat, you're going to produce more insulin. And then you get into this sort of negative loop, right? The rebound hypoglycemia, which a lot of women with PCOS have. And so in your mind, you think, I need more sugar because I'm craving more sugar. The only reason why you crave more sugar is because you produce more insulin. And then it's this, and you think it's your fault. You know, I can't diet. And even when they try, they don't have really great results because they're not doing the right diet. They're trying to go low calorie when that's not really what you should be trying to do when you have PCOS. And so that's just to give more of a summary of what PCOS is in real people. But then when you go in to get diagnosed for it, you need to have 2 out of the 3 diagnostic criteria. And that's the current diagnostic criteria for PCOS. And it's challenging. First of all, PCOS is not even called PCOS in some parts of the world. So it might not even be the same disease, and it is a diagnosis of exclusion. So you have to exclude all these other things before you can even diagnose PCOS. But anyhow, the current diagnostic criteria is 2 out of 3 of irregular cycles and or ovulation. So again, like you and I, you might have a cycle, but you might not be ovulating. And that sounds confusing, but Dr. Fung writes about that in our book to explain it a little bit better. The second thing is the at least expressions of excessive male hormones. You might not have clinically high testosterone and the other male hormones because these hormones fluctuate. Sometimes in women with PCOS, it's not that their testosterone is too high, but it's that another enzyme produced in the liver is too low and it's not bound. And so it's more free testosterone and doing all kinds of stuff that you don't want it to do, like male pattern baldness and male pattern hair growth, coarse hair. And the third is, of course, these polycysts, which are not really cysts, they're immature follicles in your ovaries. So there's all these little follicles in your ovaries that are not maturing, and that's why you're not ovulating. So when you look at the science behind this, all 3 of these things, and that's a big part of the beginning of our book. So there's a practical guide, which is great because people want a solution, and that's why we wrote this. Not to make this doom and gloom, but to give people hope and a solution. But there's a nice science part that Dr. Fung wrote explaining how insulin is behind all 3 of these, and how insulin then is not just a hormone with metabolic functions. It is a hormone with these huge reproductive functions, and probably a lot more functions that we're learning along the way. That's why learning how to control insulin is so important.